Until the pandemic came and hit us, I think a lot of people were not quite so aware as to how much our lives are impacted by global events that might start anywhere.
This is a real crisis.
I mean, it's been clear that this was likely to spread in the U.S.
We need to be thinking much more ambitiously.
Climate finance is a very big issue.
We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
CGD came about because it was time to focus not only on what developing countries should do, but much more on what the rich world should do.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
Some of our previous work has helped to come up with a kind of innovative financing mechanism that was used to help launch pneumococcal vaccines. We really have researchers and experts here at CGD who come at these issues from multiple vantage points, and I think that's just what helps make our research more rigorous, more rich, and actually more connected to the realities that decision makers are grappling with.
We've been looking to CGD for all of your research and analysis to guide us.
So CGD is nonpartisan. Because of that, over the years, that credibility has given us significant convening power.
Our government highly values the work.
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
Every single time that we're able to get it right, it means we're reducing significant poverty.
If you can help to make things a little bit better, that's a good way to spend your time.
Welcome to the Center for Global Development. My name is Javier Guzman, and I'm the Director of Global Health Policy and a Senior Fellow here at CGD. Welcome to our event on the role of procurement, pool procurement in pandemic preparedness and response. This event is co-hosted by CGD with the University of Oxford's Blavatnik School of Government, the Global Health Impact Project, and the Independent Research Group for Global Health Justice. And the first thing to say is, timely, equitable access to medical countermeasures is an essential part of effective pandemic preparedness and response. We all saw that during the pandemic, during the COVID pandemic, and we're talking about it when we talk about pandemic preparedness and response. And even though access depends on a long continuum of functions, from research and development all the way down to last mile delivery, procurement is a critical function that we think should be discussed. And of course, one of the options, if you talk about procurement, is pool procurement, which has been seen as a great option because of all these different benefits, including aggregating demand to improve bargaining power, reducing prices, having the option to negotiate with several providers, having a portfolio of products, reducing transaction costs, securing quality, you name it. However, we all saw that during the COVID pandemic, countries decided not to go with pool procurement mechanisms. And we all saw that many countries went for bilateral deals. And those procurement mechanisms, those pool procurement mechanisms were not as successful as the world expected them to be. At the global level, of course, we had COVAX. We had the fastest vaccine rollout in history. That's a paper two of my colleagues published last year. COVAX, raised $12 billion and has delivered 1.9 billion doses of vaccines globally. But it was late and it wasn't equitable. At the same time, the regional procurement mechanisms like the revolving fund has been criticized for not being activated on a timely manner. So now is the moment of, moment to reflect, moment to see the past, but to look at the future and see exactly what the role of pool procurement is, especially when people are talking about creating regional procurement hubs or expanding regional procurement hubs. Others are talking about strengthening governance arrangements and mechanisms, or securing financing early on. So we will discuss the role of pool procurement in pandemic response. And for that, I've got a stellar panel today. We've got Santiago Cornejo, who is the executive manager for a special program regional revolving funds. First thing to say is that this is a new development. It basically means that the two funds within PAHO have been combined under his leadership. So welcome, Santiago, and congratulations on this new position. We also have Karar, head of health policy at Save the Children. We've got Beverly Lorraine, who is Assistant Secretary of Health for Universal Health Coverage at the Department of Health in the Philippines. We don't know if one speaker, confirmed speaker Andrew Jones, who is the Principal Advisor and Chief of the Vaccine Center at UNICEF, will be joining us. He's confirmed but has not joined, so he might join a bit later. But just to get us started, well, thank you to our panelists for being here. And I just wanted to ask a very general question, which is there a role for pool procurement in pandemic response? Is there a role? And if so, if you think there is, at what level? Are we talking about global, regional, sub-regional? And what products are we talking about if we talk about pool procurement? So, Santiago, do you want us to get us started? Thanks for joining.
Thank you, Javier, and thank you very much for inviting us and to this very important conversation. And as you said, I think it's time for us to reflect on the things that work well and many of the challenges that we have, because definitely we need to do things better the next time, because now we know that it's not if a pandemic will happen again, it's when and which one it will be. And of course, that also what we need to think or look at is a single one solution doesn't fit all. We need to keep that and have that caveat that it will depend on what that next pandemic will look like, what is the and what will be the possible solutions. But one of the lessons that we have in terms of the work that we have done in COVID is that definitely just relying on bilateral deals will not ensure equitable access. That was clearly reflected. So there is a need for pool procurement. There is a need to have a mechanism that will ensure that all people will have access on an equal basis. Now, also the COVID pandemic show us that is the issue of unequal access it had was not related to income. So there's a misconception thinking only the rich countries had early access. No, it was not. When you look at what happened, it was not just linked to income. It was mainly linked to access to the vaccines or the diagnosis, who had the production. So this is also an important element for us to think that the typical paradigms that we use in development of just looking at income to stratify or to think who has equal or unfair access, I think we need to rethink it in the case of a pandemic. Now, I believe that we need to look at pool procurement. I think it will be a combination of all. Definitely, we need a region at regional level, and we can talk about that later. But one of the key advantages that we see from a regional perspective is closer link to the countries in order to ensure that where the needs and where that could be allocated, and more important, the solidarity aspect. Any solution will require greater solidarity commitments from countries, and I think from a regional level we have greater tools. But we will need also a global coordination. Just to rely purely on regional, I think the outcome might not be enough, and we will need some global level of coordination will be important the next time. The final two issues that I will highlight, Javier, you mentioned, and it's critical because just thinking on the pool procurement alone will not be enough. We need the governance aspect. We saw the impact that have, for example, export restrictions during the pandemic. That cannot happen again. If not, the pool procurement mechanisms will be ineffective. Also, we need transparency there was not enough transparency in terms of deals, access, production, and therefore that also hampered the solution. So we will need better transparency the next time. And then finally, also the issue of profit. What is important, of while we understand that manufacturers need to make profit, also what we need to be aware of, it cannot be record-setting profit during a pandemic. So these elements from a governance perspective will need to look. The final point is financing. You also talk about their discussion about financing. There is a need to have earlier access to financing, and more important, to have the ability to do risk financing, which most pool procurement mechanisms that had been set up don't have that capacity to do risk financing. And without having that ability, there will be a lot of restrictions, or not the pool procurement mechanism in a pandemic will not be able to act swiftly, quickly as it will be needed. So I think those two components of governance and financing will need to be added to the structure that definitely has a very important role from a pool procurement from a regional level and also from a global level.
Thank you, Santiago. So the first vote is for regional. Karar, what are your thoughts? Is there a role for pool procurement in pandemic response, and at what level and for what products? Over to you, and thanks for joining.
No, and again, just echo Santiago's kind of remarks, in that we appreciate you guys for inviting us. And I guess pool procurement has been a long sought after ambition, right? And that's for kind of other commodities. The irony is the first time I met Santiago was actually in a regional African middle income country meeting, whereby we were discussing pool procurement for vaccines. And it's funny how it's come kind of full circle. But the challenges on the kind of the regular pharmaceutical market are well known, right? Around political will, around divergence in country needs, the product differentiation, the predictable financing that Santiago talked about. And these are kind of long-standing challenges. Now, in pandemics, some of these challenges start to kind of wither away, in that, you know, the need is kind of undeniable. You typically have oligopoly markets, so whereby you have one or two products. So the notion that you have a plethora of products to choose from and different country preference is kind of diminished. And then, you know, according to the kind of need and the frenzy that we saw with COVID, the political will is typically there, along with the financing needed to kind of achieve it. So I guess how pool procurement will play out in pandemics depends on two things. Whether we adopt a kind of status quo or if things stand as they are, or the other alternative is some of the kind of pandemic preparedness and response architecture is strengthened. Now, from a status quo perspective, aka if things stay as they are, and we're essentially this kind of pre-COVID naive PPR kind of state, you essentially have the same kind of structural issues under play, whereby we had a handful of countries engaging in kind of bilateral deals. And these, as Santiago mentioned, wasn't necessarily linked to income. I would argue they're probably linked to countries that had a bit more of a strong industrial policy or life sciences approach. And so you had the likes of, for example, the UK government, so the vaccine task force, adopted a very kind of aggressive approach, whereby they brought private sector partners to actually engage in this kind of deal making. Now, when you compare that, for example, with the likes of the EU had a similar phenomenon or similar kind of approach in terms of they wanted pool procurement, but some of the bureaucracies around alignment we saw probably came to their detriment in terms of being at the front of the queue, so to say. So if the status quo kind of persists, whereby we have, for example, a underfunded CEPI or pandemics or pathogens of pandemic potentially there with no vaccines in play, then the same kind of cascade of events around taking a bet on a portfolio of vaccines early on that are potentially still in clinical development, whereby you have to kind of invest at risk in the production of these vaccines, and then also engage in the kind of bilateral deals to secure them. We're going to see that play out again. That said, if we're able to get certain infrastructure in place, aka we know what these pathogens are, we have the world's insurance policy in the form of CEPI or other public-private partnerships investing in these vaccines early on with access conditions underpinned, I believe that then that will allow for certain kind of things to happen downstream of that. So if we know the commodities and we have those commodities kind of in place for those pathogens, if we're able to get a predictable financing mechanism in place around, you know, the pandemic fund or the likes, and then also having a normative or rules-based system whereby countries, you know, let's say split up the supply amongst them And that also requires us revisiting our social contract with the private sector, as Santiago kind of mentioned. I think all those enablers in place will make pool procurement a very kind of viable and possible kind of prospect going forward. And that is evidenced by, for example, as I mentioned, pre-pandemic, we were trying to get pool procurement efforts at a kind of regional level. All of a sudden, the pandemic hits, and one of the silver linings of the pandemic, in my mind, is that self-sufficiency agenda and countries waking up to the need to achieve health policy objectives through industrial policy. So, the birth of the African Vaccine Acquisition Trust and that pool procurement happening at African continent level. For me, that's a big, big win. We saw the EU engage in a similar sort of phenomenon, and likewise with COVAX. I mean, some of the challenges, or the recall bias, I would say, around COVAX, in my mind, all things considered, COVAX has been able to achieve huge gains in terms of the deaths averted globally, but then more specifically to some of the kind of countries that faced huge inequities, predominantly kind of the likes of the African continent, etc. So for me, if things stay as they are, pool procurement could face some challenges. However, that said, if we're able to get certain PPR infrastructure in place around financing, around governance, around this normative rules-based system through that pandemic treaty or otherwise, this could be a very, very kind of fruitful endeavor going forward. So yeah, that would be the kind of reflections from my end.
Thank you, Karar. Can I push you a bit on that one, just to understand? First, do you think there is appetite or there's a political window for that new governance arrangement, new social contract? Is that really a possibility now? And two, what exactly do you mean by the new infrastructure in place? And because you mentioned, CEPI, but you also mentioned the Africa Vaccine Acquisition Trust. So is it infrastructure at the global level or at the regional level? And is there appetite for that? Are funders into that conversation?
Yeah, I guess on the appetite or political will, I would say there was an element of exceptionalism as it related to outbreaks. There was always this notion that outbreaks were always something for developing countries or low-middle-income countries to deal with. All of a sudden, COVID comes in, and that element of exceptionalism is completely kind of challenged to its core. And so, for me, when it comes to the kind of political appetite or political will, I truly believe that the pandemic has been a stark kind of reality check for a lot of member states, and where we saw that a vaccine or a pharmaceutical commodity was the route out of that kind of pandemic. I truly believe that the appetite is there now, and some of the efficiencies to be achieved out of the kind of pool procurement, I think these are kind of undeniable. And so for me, seeing some of the experiences on COVAX, and let's not forget where COVAX was born out of from, right? So we have previous kind of examples such as the H1N1, whereby it was a strictly dose donation endeavor. So when you look at the vaccine deployment initiative for H1N1, again, a handful of high-income countries buying those doses, and then donating those doses after the wave had kind of peaked. We fast forward to 2019 or 2020 with the COVID pandemic, and a very refined infrastructure in the form of COVAX or the Access to COVID Tools Accelerator has been set up. And so if we were to say human learning is incremental, for me, having kind of witnessed COVAX play out, I think the appetite and the realization that this could be achieved is there. With regards to, do we have what kind of infrastructure at a global level ought to be in place? I mean, you look at the Access to Medicines Foundation, and they looked at, for example, the top 20 large pharmaceutical companies and where they were operating in terms of priority pathogens or priority R&D projects. And the reality is, for a lot of these pathogens, private sector is not heavily involved in this. And so there was a huge amount of public funding that was in place. However, that said, I'm not really too sure as to how stringent some of the access conditionalities were within those kind of early funding arrangements. And so now that the realization has kind of dawned on pretty much kind of the global community, how strict will some of those access conditions be embedded within some of the upstream R&D, whether it be for kind of existing pathogens or some of the kind of neglected pathogens going forward? And so can they earmark towards some of these kind of positive access conditions, whether it be on pool procurement conditions or some of the kind of flexible intellectual property kind of management approaches? So for me, I think, yes, that realization hopefully would have changed the approach going forward. And just to say, in terms of the other kind of architecture we're seeing, the pandemic treaty that's being discussed, hopefully will allow us to revisit what is this normative rules-based system of how governments ought to act when a pandemic hits, so that we don't see the protectionist policies. We don't see this beggar thy neighbor economic policies around export controls and around kind of hoarding of vaccines. But likewise, as Santiago mentioned earlier, seeing some of the kind of financing infrastructure that's been put in place, predominantly in the form of the World Bank's pandemic fund, hopefully that will allow us to engage in a preventative kind of approach, as opposed to this boom and bust kind of approach that we're seeing with outbreaks. So yeah. I think you're on mute, Javier.
Sorry, thank you. And let's go to the country level perspective. Beverly, can you please tell us a bit about the experience you went through in the Philippines and what your views are in terms of the role of pooled procurement in pandemic response going forward? Thank you very much, and over to you.
Thank you, Javier. I echo a lot of the sentiments of my co-panelists. I'd frame my answer in the way that clarifies what is the goal in terms of preparedness and response. Definitely, it's to make sure that we have equitable access inter-country and within the country. With access should come effective and efficient use of those technologies. And finally, maybe this is something that not everyone talks about now, but I'm pretty sure that in most of the governments, we are being criticized for waste, no? Meaning unused vaccines, for example, that may, some have been bought and even some have been donated, but still get counted as waste, no, or unutilized health technologies. If I look at all of these three outcomes, definitely the need for pooled procurement will have to be there. And the infrastructure that has been described earlier, a more formal infrastructure than what we had this pandemic would probably be helpful. So for example, in our experience, first, because there wasn't an assurance that we will be getting whatever our country will be needing from a single platform. For example, COVAX, initially they were just saying, we can only give you maximum 20%, no, of your entire population. And maybe you can even pay for 5% of that, but that's it. Because of that, the country had to go out and do negotiations. And because we're definitely not a wealthy country, we had to go and bite the bullet and apply what they would call a portfolio approach. We rolled out almost 7 types of vaccines in the country because we had to negotiate with different providers. And you would then know that that has implications on effectiveness and efficiency of your deployment, right? Because when other countries only had to explain to the public, this is the difference between Pfizer and Moderna, for example, month after month, we were informing the public, oh, vaccine A is now rolling out, then B, then C, then D, then E. No? So a lot of complications even in capacitating your providers on what to use. And definitely you have more permutations in terms of succeeding policy and operational questions just because you rolled out so many more types of vaccines. Second is, as what was mentioned earlier, if we want to do pooled procurement, there has to be a way around financing. And for example, in our case, we have very stringent procurement laws that does not allow us quite simply to advance payment. Then that also meant that we had to work with our private sector in the country, and so that they will be the ones who will do the down payments, no? with the bigger bilaterally negotiated deals. But that also meant, again, another complication. No? So the private sector being able to buy, put in money and buy, and also some of our wealthy cities saying, okay, we also want to buy on our own and sign those contracts. Because they will be able to put out the cash when the national government will not be able to. This was allowed. But again, complication in the next steps, no? And that would include, say, aggregating orders and allocating the population who you're buying for. And definitely because the supply chain wasn't as stable, what happened was whatever the national government bought came in earlier. And so when it was time for the private sector to vaccinate the people or their employees who they're supposed to vaccinate, they already went to the government centers. No? So I guess what I'm trying to just say is that when the pool procurement systems are not as organized, they all have far-reaching consequences in terms of the response. And definitely that complicates a lot of the implementers' work. So I guess I'll end there first. Thank you.
You about the Philippines and the regional pool procurement possibilities. I mean, we heard from Santiago that he's leading an effort. There's a conversation about that, and we'll hear more about it. But is there anything happening in Asia at the moment about pooling efforts and discussing pool procurement? Can you talk a bit about that?
Yes, I think there are discussions ongoing now with our development banks in Asia, looking at the possibility of pooling some small fund within the ASEAN that should start off, or that will be used in any future case of a pandemic. But in terms of the specifics of who produces what, mapping at least where certain goods are going to be better produced so that we don't all build entire systems entirely and not work together. I think we still have a long way to go there. We probably are not as organized as maybe EU or PAHO, but hopefully we get there.
Thank you, Beverly. And welcome, Andrew, to this panel. So Andrew Jones is Principal Advisor and Chief of Vaccine Center at UNICEF. Thanks for joining us. So I'll ask you the initial question, which is a general question about what is and whether there is a role for pool procurement in pandemic response. And wanted to hear not just whether there is a role, and because if there is, or if you think there is, we want to know whether it's at the global, regional, sub-regional level, and if there is any preference for the type of product that this pool procurement should be for. Welcome, and over to you.
Thanks. Thank you, and apologies about joining late. There was a calendar error. Yeah, I mean, I think in the case of a pandemic, I would say pool procurement of some sort is almost essential because, we saw a bit with COVAX, but I think even in less global pandemics, there is still usually a shortage of supply, and there's significant competition for that supply. And so if everyone is buying for themselves, you may get optimal outcomes for those who have perhaps the most money. But if you think about the overall welfare and outcomes for the society as a whole, it's likely not to be optimal. And so by pooling procurement, it in theory allows you, because you're able to pool your demand, and also usually it gives you some ability to hedge your different, potentially if one country goes up and another country goes down, obviously you can hedge between it so that your overall contract with the manufacturer in question would still be sound. And so I think there's a number of advantages to pooling. I think whether it's I would tend to think regional or global, depending on the scale and scope of the threat. So, I think in COVID, because it was global, there was an aim to do global procurement. I think perhaps early on in COVAX, we set the scope a little too broad, where we expected high-income countries might participate. But I think on a large-scale pandemic threat, there's advantages to having a global level. But certainly, in a lot of things we see, like outbreaks of cholera or outbreaks of yellow fever, things that are more regional threats, it would fit well to have regional procurement. But I would certainly, as I said, support in a situation where you have a pandemic. I think pool procurement offers you a number of advantages.
Thank you, Andrew. And so let's talk a bit about that regional approach. And I wanted to ask you, Santiago, about what you guys have been working on. You mentioned a bit, those crucial elements for a regional initiative to be successful. But can you tell us a bit about what the plans are? Because clearly we saw that, or we've been talking about different elements. We heard about financing, we heard about local manufacturing, we heard about local threats. But what is it that are the main elements within this work that you are leading in the Americas?
Yes, thank you, Javier. And here also we need to look at, because while we had first with COVID, then we have, if you remember, the mpox response, which of course was not at the end at the same scale of COVID, but they're already the PAHO revolving fund in response to mpox already have took some actions in order to be able to provide access to vaccines. To vaccines to our member states. And what are some of the elements? Well, some of the elements, as I mentioned, was one is the ability to be able to make deals and to take some risk by procuring or securing access to a certain amount of doses that irrespective of which countries will be receiving. So that ability to do an early deal, to have early security, was quite important, what we saw in the mpox response. So that already gave us some answers. So what are we looking? Well, as I said, first is one of the key concepts is solidarity, is to ensure that the commitment from the government to an approach that will ensure equitable access, and that we have a long history with the PAHO revolving fund and the solidarity that member states have shared. Second aspect of the benefits that bring these approaches of pooling and particularly the regional level is, of course, the regulatory harmonization, how we can bring and ensure access very quickly. But then some other aspects that we're looking is one of the lessons of the pandemic was of the COVID and the restrictions we have in terms of access to vaccines is the need to have a more diversified production capacity. So we're working in the region now. One of the silver linings of the COVID pandemic, as it was mentioned by previous speakers, is that there is political interest to have that capacity to produce vaccines and other essential medicines. So as a revolving fund, as a regional procurement agency, we can help to incentivize that production, to coordinate those efforts, because of course it cannot be that every country can produce all the products. So how do we ensure a sustainable environment that will ensure that then once there is a need, that production can be tapped? So from a regional perspective, a regional revolving funds, we're looking at how we can play a role in helping that diversification of production to ensure that the region will have access to some of the products. And then the other elements that we need to look, and we are looking, is as I mentioned, is the financing. I think when we look at financing, we tend to think of the issue of amounts of resources that will be needed. Yes, the amount of resources is important. It's a critical question. However, it's not just the amount. As I mentioned before, it's also the ability to take risk. And here, when you talk about pool procurement mechanisms, our ability to take risk is not, we don't have that. So how we can have that ability will be very important if we want to be responsive. Because if we want to be responsive, we need to have an agile, a quick actions. We need to take those quick actions. And if we don't have the tools already in place, definitely it will take time. And that time is, of course, will be transformed in that. So that's where it's very important to have, from a financing perspective, the ability to be able to do those investments that will be required. We're working with our member states in terms of diversification of production, to have the ability to have those products, and of course, in order to do that, the issue of regulatory aspects will be very important. The other point that, if I can't also add, that I think it's something that we really need to think about, is a concept that Burley mentioned, that I think also now we're seeing in terms of the negative, I would say, impact in terms of COVID, at the COVID response, which is this concept of waste. Many countries have procured too many doses. And I think we need to be very careful with these messages, because in a way, when we were looking at what will be the from a vaccine perspective, the potential solutions or vaccines that will be successful, we were doing all modelings based on history. And what it turned out to be is that from a COVID perspective, actually most vaccines were successful, which has never happened in the past. So that's why we had too many vaccines at the end. Now, we need to be careful with that thinking that that was a waste of money or waste of resources, because we don't know what will happen in the next pandemic. And if we will be so lucky, if we can say that most products will be successful. So if we come already with the thinking that we need to be cautious in terms of our investments, in terms of diversifying the potential solutions, we might find that we will not have enough resources or enough vaccines or therapeutics. So we need to be careful with this lesson, if we can call that, we have too many vaccines wasted, because yes, we at the end we procure more than was needed, but it's because we were very lucky with this in this case. If in the next pandemic we are not, and only one product, one vaccine is successful, and we didn't invest in that, that will be, I think, quite detrimental. And I think this is the other aspect, which the pooling mechanisms provide a great advantage. When you pool demand, you pool resources, you have the ability to diversify in terms of different products that you can't early on secure that supply. If you tend to have a more bilateral approach, it's very difficult, unless you're extremely wealthy, to be able to have it. Or even if you have production, you might have production for some, not for others. So that's where this the pooling mechanisms will bring a great advantage. But let me also emphasize, while as a region we're already working to be better prepared, to be able to take advantage of some of the capacities that we have in our region, some of the experience that we have with our revolving fund in terms of the solidarity. Also, it will be very important that if, as Andrew said, there's a global pandemic, that then we are part of a global mechanism. It cannot be each region on its own. We need to have to ensure that coordination, that ability to inform, to provide, and to ensure equal access across different regions will be very important. And I think it's one element that perhaps in the COVID response, the input, the engagement of the different the regions was not as strong as it should have been. Thank you.
Thank you, Santiago. Let me just ask you a bit about what you just said. You talked about diversifying manufacturing and how the region is working on it. Has there been any pledge or any formal linkage between that supply and the demand? In other words, have you been able to made a formal pledge as part of the revolving funds that X number of doses, in case it happens, will be procured for those manufacturers who are working to produce locally? Or that is still work in the making, and the manufacturers are just working on increasing the supply without any secure demand?
No, it's work in progress. I think it's still work in progress from several elements. One is from the manufacturing side, in terms of producing, having that ability, but also from our side, from a revolving fund, we need, as I said, we need to have that ability, to have those tools from a financial perspective, to be able to make those commitments. But it is something that we start in the dialogue. We're starting to work to think how we can best react and be prepared. But as I said, it's work in progress. One of the benefits of the revolving fund is that the members is the fund of the member states. So that's what it helps us from a solidarity perspective, but also any decision, any that needs to be made, of course, it will have to come from our member states, which creates a lot of power in terms of action once those decisions are made. But as I said, we are working because we need to be prepared. We have a lot of lessons from the COVID pandemic, and we need to set up those mechanisms early on if we want to be ready, because we don't have, one of the biggest lessons is we don't have the luxury to set up the mechanisms, the tools, once a pandemic has started.
Sure, definitely. That's why we are here and we talk about pandemic preparedness. So seizing the moment. Beverly, you talked about, how the Philippines had to go and, procure themselves because COVAX was only guaranteeing 20% from the beginning. So if you think about the future, and I'm not asking you to speak on behalf of the government, this is just your opinion as an expert. What do you think are these, deal breakers or these prerequisites for a country like the Philippines to join a regional or a global mechanism? What are the key elements that must be guaranteed for this to work?
I think definitely both ability to obtain health technologies from that group, but at the same time be able to take part in the entire part or entire manufacturing chain, so that there is also in a way a level of return, so to speak, that will be available for the country. Second, perhaps really access to financing. So in this case, we explored using private sector funding, but also really took up loans immediately, because that was the only thing that allowed us to reserve or take orders for the bilateral agreements. Third, I would say is actually more internal within the country. And that's what we're working on, really, is to strengthen our primary care systems, health information systems, and specifically logistics and management information system. Because even if we were able to get the goods back into our country already during the pandemic, these three things, because they really weren't strong to begin with, were actually barriers in itself, and how we were able to use and apply the technologies in the fastest possible time. So I probably would say that for that last piece, health human resource is actually a big thing for us. And during the pandemic, we actually lost a lot more health workers, particularly to high-income countries, not so much to our neighboring, to the region, but to a lot of the global north. And there isn't really still a mechanism for us currently to at least plug that gap. So.
Thank you, Beverly, for reminding us that the product is just part of it, and there's a difference between a vaccine and a person vaccinated. Please, just to remind our audience that we will take questions. So please post your questions in our YouTube channel or send us your questions to events@cgtef.org. But before we get into the questions from the audience, Karar, we heard about governance as a key issue that we need to deal with. Bev just said, they would like to be part of the pool procurement mechanism in terms of, from the beginning. Santiago talked about, the importance of having regional voices or the regional developments to be part of a global coordination mechanism. What do you think are the lessons from the COVID experience in terms of governance arrangements? And how do you think these governance arrangements should be solved, should be fit for purpose? I mean, what issues should be solved?
Yeah, no, this is a very good question. I guess the governance question has to be kind of a reflective piece for all the entities that were involved in this kind of COVID response, right? And that begs the question of what are the governance systems around the kind of private sector? What are the governance systems around how member states ought to be behaving? And what are the governance systems around what the multilateral system ought to be kind of doing? I think on the kind of most contentious and the most political one that we've seen play out is that around the kind of private sector. And, what was already kind of mentioned, some normative guidance around, for example, transparency. In this pandemic, we saw a private sector transparency kind of approach to a public health response, and that frankly wasn't good enough. And so, I remember some of the early discussions with COVAX. We had zero visibility in terms of delivery schedules, in terms of what the bilateral deals that were secured, and that made it very difficult, for example, for COVAX to even rationalize should countries be double dipping, so to say. The high-income countries had their own bilateral deals of which there was very little visibility, and then we're also tapping into these global procurement systems. And what are the ethics of that? And that's why I mentioned that we need to revisit this social contract with the private sector. And that includes, for example, as I mentioned, the transparency angle. That includes issues around earmarking of supply. So if we have bilateral deals going on, as well as a whole host of regional initiatives engaging in pool procurement, the same phenomenons still kind of play out in terms of who gets what first. And so, we saw, for example, with the IFPMA or the International Federation of Pharmaceutical Industry Association, they put out the Berlin Declaration, and that has in there what the industry believes to be their offering. And so for me, that's a good start. But these discussions are to be had in peacetime. So as I mentioned, stuff around transparency, around earmarking supply, governance as it relates to how countries ought to behave. I mean, the whole notion of kind of export controls, we saw that play out as quite a blunt instrument for countries that hadn't engaged in this first mover advantage. And so, for example, we saw this happen with the dynamic between the EU and the UK, for example, where the UK, as I said, adopted this kind of very agile vaccine task force, private sector led, so to say, engaged in bilateral deals early on. The EU, because of the kind of bureaucracies of this getting consensus across 27 member states, took a little bit longer. But then their response was a very blunt response in that of an export control. We saw the same play out with the Indian government, for example. And so, in a pandemic treaty or with this international negotiating body that's discussing this global rules-based system around future pandemic preparedness and response, what conditions are in there to dictate how countries behave in terms of this kind of protectionist policies? So that's the kind of governance on the private sector front, a governance in terms of the member states level, and then governance in terms of the multilateral response, I think begs the question in terms of kind of inclusion. I think we saw challenges, as was kind of reiterated, as to what does it look like, for example, for countries, high-income countries, to both have access to the pool procurement pot, as well as undermining that very pot that they're allegedly supporting through some of the bilateral deals. So what are the governance structures therein? Some of the governance structures around, for example, should the private sector have earmarked supply for these kind of multilateral systems? And what is the ethics around having that kind of earmarking of supply towards the WHO or towards a future medical countermeasures platform or the like? And so for me, I think some of these kind of issues have to be discussed in peacetime. I think it's very futile in an attempt to have these governance discussions around pricing, around access conditions and public R&D, around earmarking of supply in the middle of a pandemic, because your hand is in the fire. And so for me, these kind of discussions are to happen in peacetime when, when we're discussing the pandemic treaty, the pandemic fund and the like. These prerequisites, this kind of normative rules-based system ought to be put in place right now, with an element to be able to stress test these systems so that when a pandemic does hit, that we know what the rules, what the rules-based system entails, what the ways of working entails, what the collaborative system entail. And so we're not building this fire engine in the middle of a fire, so to say. So yeah, these are some of the kind of pieces that I would say spanning transparency, spanning kind of public access conditions, spanning the kind of coordination between regional and global. And I would just say one last piece in terms of this regional global dynamic. I think the danger of this being a global piece seen entirely in that manner would be that, pandemics start and end in communities. And if it gets to a level whereby it is a public health emergency of international concern, that, in my opinion, is way too late. And so the danger, I think, of the rhetoric of pooled procurement systems for pandemics being at a global level is that these kind of outbreaks, which could be quashed with an adequate regional response or national response, if the threshold to invoke the full architecture of financing, of political attention, of kind of private sector engagement, if that threshold is set too high, then we're going to see, these pandemics increase in nature because we're not able to kind of quash them when quite early on, when they are happening at a kind of much smaller level, which are probably kind of a bit more kind of manageable. So that is probably a dynamic for us to consider in terms of this regional versus global piece.
Thank you, Karar. And we got, yes, Andrew, you want to comment, but before you comment, I will also ask you, or pose a question that we just got from the audience. It is, what are, what are the tangible things that a global mechanism could offer to countries for countries to join? I mean, we saw in the pandemic that the countries just didn't join, even though, as you said, Andrew, clearly, rationally, we were all better off if we would have worked together. But politicians didn't behave, or actually did behave rationally, because they are responded to their constituencies. They're not in charge of the overall welfare for humankind. So what are these tangibles that pool procurement could offer? And of course, your comments on the previous questions, if you want to add. Over to you.
Yeah, I can. Thanks, Javier. I can do both. I want to build off a couple of points Karar mentioned, which fit in with this. So, with your question, I think, as much as we would like, and countries may say they won't put in place export controls, if a pandemic gets bad, I would virtually guarantee any country is going to put in place an export control, regardless of what they might say in peacetime, right? So I don't think we can rely on that necessarily. And even within a region, right? It's not the case in Santiago's region that if Brazil is producing a vaccine, in theory, you would expect they would supply all of PAO, but they may choose to stop exports, and that would go the same in the African continent. So I think the lesson we draw from that, and which gets a bit to your tangible questions, yes, Karar's right. The Berlin Declaration has put something forward. I think it's inadequate. I think what we really need to look at is, unless something radical changes, the highest income countries that have more money that they're willing to pay will generally get first in line. So I think it's really a bit beholden on them to make commitments that they would as part of their agreement. So let's say the EU, for example, that a portion of their committed supply is guaranteed to go to a global procurement, pool procurement, or several regional pool procurement, take your pick. But I think having that commitment up front then gets a bit of this issue of where you fit in the line, right? Because part of the problem with COVAX and others, and I think this would go for regional procurement too, would be the Americas or African regional procurement would probably come behind European procurement, just given the prices and that they're paying, even though companies might say otherwise. So I think that's why it'd be important that you actually, and the pandemic treaty is trying to do this, that you would actually have an agreement where high-income countries are willing to make that commitment up front, because that is the big thing. If you can have a guaranteed portion of supply right up front, we get away from some of the failings there, because some of the failings were, yes, there was export controls. Those might happen in the future. But if we have multiple agreements with multiple suppliers, and this is done in collaboration with high income countries, in some sense you hedge against that and allow vaccines or other commodities to flow to low and middle income countries at the same time. So I sort of think that is the essential thing, and it gives you a tangible thing to offer countries. But I also think, to your other point of your question, I don't think it's actually what we've seen from experience is a pool or regional procurement is probably going to serve middle and lower income countries. Most high income countries are going to go and do bilateral deals. I mean, the EU obviously worked as a group, but as a general rule, I think having a global architecture that aims to serve high income countries probably isn't where it's needed. Where it's needed is for high income countries to make a portion of their supply available to low and middle income countries.
Thank you, Andrew. Another question from the audience, and this is for you, Santiago. Have you had any, or has intellectual property had any barrier, or has it contributed to any limitation in the pool procurement efforts that you've been working towards?
Thank you. And just to, I think the issue of intellectual property is very important. Of course, it's different if we're talking about medicines versus vaccines. I think so we need to look at it very specific to which one we are referring to. In medicines is a very important, play a very important role to have access or no restrictions from intellectual property in cases of a pandemic, etc. The cases of vaccines, the intellectual property right play a role, but it's not the only issue. In fact, I would say that the most important issue is the technology transfer, and that other manufacturer producer have the ability to produce these vaccines. Vaccines are very complex in terms being biologicals in the production, and therefore what is required is not just having open property rights will not ensure that every manufacturer in every country will be able to produce it. It's all the opposite. It requires significant investments in terms of technologies, in terms of practices, and that's why it needs to be, if this concepts of intellectual property rights, when we talk about vaccines, it need to be also be linked very close to transfer of technologies, and a real transfer of technologies, not just a fill and finish, but a production that is able to do the full end-to-end production of vaccines. So this is very important for us to look at.
Thank you, Santiago. And we're coming to the end. So I just wanted you all to have the opportunity to, give us your 1 minute takeaway message, or how would you summarize this key question of what is the role of pool procurement in pandemic preparedness and response? Let's start with Karar. Final remarks, 1 minute, and thanks for joining.
Yeah, I guess for me, pool procurement definitely a central tenet of future pandemic response and kind of architecture, provided we're able to get certain infrastructure in place. Predictable financing or at-risk financing that, PAHO or the like is more than happy to stand up in front of the electorate and say, we've lost billions of dollars because the risk didn't pay off. The ability to be able to do that, I think, is integral, as well as some of the enablers I mentioned around, a rules-based system on behalf of member states, put in certain kind of prerequisites on transparency on the part of industry. We've already mentioned the kind of flexible financing, and then, a sustained kind of political will or an acknowledgement that these are global public goods and that the only way out of a pandemic is through a kind of a global response. So I think, provided these kind of certain enablers are in place, we know that with these global health R&D projects, there are structural issues across every aspect of the pharmaceutical value chain. And there would need to be kind of a linkage between the commodities that we're investing upstream. What does that look like in terms of the same commodities having certain kind of pool procurement or demand assurances? And so for me, this end-to-end solution requires kind of a complementary approach, and that pool incentive or pool procurement alone will not be sufficient. And that requires, as I said, these interventions across every aspect of the pharmaceutical value chain.
Thank you, Karar. Beverly?
Thank you. For me, I think global and regional bodies should be relentless in working with national governments as well as civil society organizations and the private sector during this peacetime, and actually building an infrastructure not just for pooled procurement, but really for more effective collaboration. But I guess more importantly, found or make sure that this infrastructure is actually founded on the values that will allow us to equitably and timely distribute these health commodities. And that would entail a lot of the points that has been discussed today around, pledging towards equity. Thank you.
Thank you, Beverly. Santiago, final remarks.
No, thank you, and thank you very much for hosting this panel. I think when we look at definitely one of the key lessons, nobody can be a country or even a region in a pandemic will not be able to save itself alone. So we will need a global action in terms of coordination. Now also regional entities, regional procurement pooling will play important role. It needs to play an important role because of we need to be closer to the communities, as Cara mentioned. We need to be closer to the countries, and because solidarity will be critical. I think for us, I think pool procurement mechanisms will play an important role, a critical role, and it cannot be just looked from an income perspective. Yes, I agree in a way, Andrew. Some of the high income, the high income, large resources will be able to solve the US, the UKs, and Europe. But when we look at high income, small island states will not be able to look at. So, and that's why we need to go beyond income. And this is where I believe regional arrangements can play a very important role.
Thanks, Santiago. Andrew, final remarks?
Yeah. I mean, I think we've all said pool procurement is essential. And I think, whether you do that regionally or globally will depend on the nature of the threat. I think, at-risk financing is a key point, as Karam mentioned. I think the pandemic treaty offers some ways to resolve some of the challenges we saw with COVID-19. But to borrow Santiago's word about solidarity, I think, as I said before, the biggest difference could be the highest income big countries, US, UK, Europe, really solidarity with low and middle income countries and making arrangements that ensure them access. And that will be the biggest thing to change. Thanks.
Well, thank you very much. I guess I would say, pool procurement does have a role, and we should work on the prerequisites, the enabling factors that we all discussed and heard today. So I think the what is very clear. What is less clear to me, and some questions remain, is the how. How do you get agreement on all these different issues, and what are the best mechanisms to make sure that you do have the financing, that you do have the legal provisions for financing at risk, so you do have the pre-agreement in peace times, that you have the what's in it for the countries themselves to join these mechanisms. So I guess we will continue this conversation. Thanks to you all for joining this panel, and thanks to your audience. Have a good day. Thank you very much.